This is a demonstration of the Air Force One Nebuliser compressor. A nebulizer turns liquid medication into vapour for inhalation. This Air Force One unit has a sealed power supply at the back, an air outlet on the top, the on-off button is at the side, and there's a storage space for the nebulizer unit at the front. These units should be used with the Trust nebulizer delivery devices, which come in a sealed packet containing of a small plastic medication chamber, air tubing, and a mouthpiece for delivery. Some patients prefer to use their nebulizers with a face mask, and we would just use a simple face mask for this, which can connect to the small plastic chamber. Medication should be put into the small plastic chamber and then resealed. You can then attach your mouthpiece to the top and then the air tubing to the bottom. The other end of the tubing then goes to the air outlet port on the top of the machine. Make sure the machine is plugged in and switched on at the wall. You can then switch it on at the side. If your patient is using the mouthpiece, ask them to seal their lips around the mouthpiece, relax, breathe normally, and inhale the vapour that's created by air being driven through the chamber into the delivery device. This process will last about 10 minutes and then the vapour will stop and you can then turn off the machine. If you were using the simple face mask, it would just sit in the top of the chamber like so, and then you place the face mask over the patient's nose and mouth. And again, once it's finished vaporizing, you can remove that from your patient and switch off the device. These devices need to be cleaned every day, and the outer surfaces can be wiped just using a Clinell wipe. The delivery device should be disconnected and then disassembled and washed in warm soapy water, rinsed and left to dry naturally. Once visibly dry, you can reassemble the device, run the air through it for a few seconds to make sure it's completely dry on the inside, and then store on the front of the unit. Each clinical area will have a supply of the Air Force One nebulizer devices. If you need additional equipment, please contact the equipment library on 6567. If you notice any faults or have any problems with the machines, please contact Clinical Engineering on extension 3181.